Each year, peripheral arterial disease affects millions of people, putting their life and limbs in jeopardy. Here to tell us the signs and symptoms to look out for and how to stop the disease before it gets critical, Dr. John W. Davis with Davis Vein and Vascular Center. Good morning.
Good morning, Deborah. How are you?
I am good. All right, you are a graduate of Texas Heart Institute, board certified in cardiothoracic surgery, and trained by Dr. Denton Cooley, who was groundbreaking as a heart surgeon, performing the first total artificial heart transplant. That had to be a great experience for you.
It really was. You know, people talk about his success, but what really impressed me about Dr. Cooley was his humility and the way he treated everybody with kindness and respect. So not only was he a brilliant surgeon and innovator, but he was a great human being as well.
Yeah, I got a chance to meet him, interviewed him for the last book that he wrote. Absolutely an amazing moment. All right, peripheral arterial disease, a circulatory condition. Explain what's happening when someone has this disease.
I want to preface this before we get into the nuts and bolts. This is really a very serious condition. Peripheral arterial disease can lead to the dirty A word or amputation. And obviously that's something that we want to prevent. When patients receive amputations, up to 50% of those patients will be dead within the first 12 to 18 months. We're talking about a high level below the knee amputation, for an example. So this is a very important topic. I hope all your viewers will really tune in and appreciate what's going on here.
Yeah, the other thing is that
Deborah,
it sneaks up on a lot of people, and that's why it's so critical as well that people know what's happening.
Exactly. So peripheral arterial disease is very common. People older than 70 have up to a 20% chance of having the disease. And what's going on there in that cartoon is basically in the lower extremity, the vessel becomes constricted and reduces the blood flow to the muscles and the soft tissues of the foot and legs.
Some of the symptoms, people have a tendency to dismiss it or say, oh, that's a dermatology issue, or that's just a muscular issue. It comes with aging. But what are some of those symptoms that people should say, wait a minute, let me pay attention to this?
So the classic symptom that people commonly talk about in the medical term is called claudication. And basically what that is a Charlie horse type of pain that's occurring in the calf that occurs with exercise, typically walking, that then goes away when they sit down and rest. But other signs and symptoms include a skin color changes in the lower extremity to one or both legs, sometimes a weakness or a giving out sensation of one or both legs. And then the more late stage finding of peripheral arterial disease would be the non-healing wounds of the toes and feet.
What generally causes it? I know aging causes almost everything at some point, but what generally could contribute to this cause?
Well, smoking is the #1 risk factor in America. There are over 4,000 chemicals in cigarette smoke, and commonly what we talk about is nicotine and carbon monoxide. But the studies are clear that show that people that smoke and cigarette smoke has a negative impact on that vessel wall. And what happens is they get premature atherosclerosis or hardening of the arteries.
The tough part here, again, as we mentioned, a lot of people have it, don't even know it. It's often silent. Half the people who are screened are asymptomatic. It can result in, those high-level amputations that you talked about. It does not have to go there. So you do the screening, and then what does treatment look like?
Treatment looks like two different forms. At our lab at Davis Vein and Vascular, we provide a minimally invasive approach, and so most of these patients can be treated in our office, avoiding the complexities of the hospital in a very intimate and user-friendly setting. We're all on the same page to provide excellent care for our patients, but we do the intervention at the lab. They come in, they have their procedure, they recover. Procedures take typically between 1 and 2 hours, and then they recover and go home. We're talking about here a non-surgical approach. This is called an arteriogram with intervention. So we're accessing with small needles and catheters the arteries in the lower extremity, usually the groin, but sometimes even the feet, what's called pedal access. This is a video loop that shows a before and after for a patient at our lab that had a successful intervention. Hopefully our viewers are able to see before and after on the left side. That's an artery in the thigh that's completely occluded, called the superficial femoral artery. And after the intervention, we've successfully opened that artery and improved the blood flow, and that artery is now widely patent and providing brisk flow. This is a successful intervention. The patient did very well and is asymptomatic at this point.
Yeah, so what you did was you saved a limb and you saved a life, and you do that in a very convenient way, door-to-door concierge, transportation, a no-cost option for patients if they need it, and little style never hurts. You have a limo bus, thanks for that, and you're compassionate, competent, and that care is your top priority because there is no reason why someone should lose a limb or lose their life. Dr. Davis, thank you, sir. Thank you very much.
Thank you, Deborah. You have a beautiful voice. Do
Oh.
you have American Idol in your future?
Thank you. I'm too old. They have an age limit. Maybe The Voice. Maybe we'll try that one. Thank
We'll
you.
have to get the rules changed.
All right. And I'll sing a song about a heart. All right. Don't go breaking my heart. Davis Vein and Vascular Center is offering a free screening for peripheral arterial disease when you mention Great Day Houston. Give them a call at 936-441-1010. That's 936-441-1010, or visit them online at davisvein.com.